So I'm Jay Shore. I'm not a psychiatrist. I do play one on TV. I've been involved in the field of telemental health over the last 15 years, working with federal, state, local, and tribal agencies developing telemental health services. And as part of ACCESS now, I work part-time as the Chief Medical Officer for two entities under ACCESS that we have spun off to focus on the development of telehealth services, really focusing on starting with telemental health. And I want to thank Deb and Jeannie Pritchett for getting me here, and Scott to just say hello and introduce myself, talk to you. Really, these two companies are focused on two things. One, you can see, is Access Care Technologies, where we are developing technologies to serve access and other populations in Colorado. Most specifically, this month we're launching, over the last year, we've developed our own web-based cloud video conferencing system that includes other features like EMR and secure messaging. And it's a multi-point video conferencing platform. So really what this allows, the three things you need for it are a webcam, Google Chrome, and an internet connection. So this allows the delivery of telemental health services, hopefully directly into clinical settings, particularly primary care. We designed it that way, and it's multi-point, so you can bring multiple people into the conference, including patients, other providers, family members. It also is pushing the edge of where telemental health is going, and that's direct care into the home. So again, as long as a patient has a stable internet connection, you can also look at home visits through this model. So Access Care Technology allows us to do that. And then Access Care Services is basically a flexible contract mechanism to develop provider networks to pair collaborators together to help foster integrated care, behavioral health care into primary care sites. Particularly, we're very interested in the WHO and RICO, and really working carefully with Rob as well. We have a unique opportunity because we're housed within ACCESS to really look at these sustainable business models. Over the last decade, have been involved in 8 or 9 very successful clinical types of pilots, but a lot of them just don't have the sustainability. And so moving forward, our goal is really to develop sustainable business models, which we believe are there. And I think everyone knows in the room the cost savings, if you can capture them on the medical end, is where you get the sustainability. Currently, we're in the middle, actually, in the next week or two, we're having very intense, exciting discussions for recruiting one of our first Access Care providers, a very dynamic child psychiatrist. And so we are actually, I'm coming to this meeting because Rob and I and others in Access Care are beginning a needs assessment process to find people and hopefully some partners here in this room to begin some pilots of how we can do virtual integrated behavioral health care directly into some of the RICO sites and clinics to provide those services in both child and adult psychiatry. And I think this addressed some of the issues of, it's a warm virtual handoff with this technology. We realize that, when you ask a patient to take an appointment a month down the road or 6 weeks down the road, you lose that initiative and the immediacy of the problem. So leveraging the tools that this technology represents to try and get more immediate care, if not right there in clinic where you bring up a behavioral health care provider right there on the screen and bring them into the room as needed, at least within a much shorter time period. And so those are some of the things that we're doing. And